To succeed in advanced clinical practice and prepare for the DPE examination, you must master the mechanics of infection prevention and control. Every clinical intervention disrupts the chain of infection. It has 6 links: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Standard precautions are our primary defense, breaking the chain between transmission and entry for all patients. Within this framework, the nurse functions as the primary agent of vector control within the ward. Because the nurse manages the vector, strict protocol adherence determines whether a pathogen is contained or allowed to spread. The foundational rule of standard precautions is to treat all blood, body fluids, secretions, and excretions, with the exception of sweat, as potentially infectious. We manage this risk through 2 distinct levels of cleanliness. Medical asepsis, or clean technique, reduces the total pathogen load on surfaces and skin. Surgical asepsis, or sterile technique, involves the complete elimination of all microorganisms, including resilient bacterial spores. This flowchart illustrates the World Health Organization's 5 moments for hand hygiene, mapping the exact spatial and temporal triggers for decontamination during patient care. For routine decontamination across these 5 moments, alcohol-based hand rubs are the standard application. Soap and water are required only when hands are visibly soiled, or when there is suspected exposure to spore-forming pathogens like C. diff, as alcohol cannot penetrate the spore's protective coating. Failing to execute this basic hygiene baseline renders all advanced transmission-based precautions ineffective. When standard precautions are insufficient, we scale up to contact precautions, specifically for pathogens like MRSA or vancomycin-resistant enterococci. Contact precautions mandate physical barriers. As shown here, healthcare workers must utilize gowns and gloves while assigning dedicated single-use equipment to the patient. For respiratory pathogens, we use droplet precautions. These apply to large particles, greater than 5 microns, which fall out of the air quickly. Because gravity limits their travel, we enforce a 3-foot rule, mandating standard surgical masks for anyone entering that radius around the patient. Safe doffing requires exact mechanics. This sequence shows how pulling a contaminated gown over the face, rather than rolling it away from the body, leads to immediate self-contamination. While standard precautions protect the individual nurse, contact and droplet precautions protect the facility infrastructure from ward-level outbreaks. Airborne precautions are required for microscopic particles, those smaller than 5 microns, that remain suspended in ambient air currents. Tuberculosis is the benchmark for airborne isolation. Historical open-air wards relied on natural ventilation to manage the pathogen. Today, this requires negative pressure airflow. Volatile respiratory pathogens like SARS mandate immediate, restricted access to dedicated wards to prevent rapid facility spread. Entering these spaces requires an N95 or HEPA respirator. Staff must undergo quantitative fit testing to ensure a hermetic seal against these suspended particles. Containing airborne pathogens requires shifting from clinical behavior to environmental engineering, utilizing negative pressure and specialized filtration to control the movement of air. Equipment processing is governed by Spaulding's classification, which categorizes medical devices as critical, semi-critical, or non-critical based on infection risk. While semi-critical items require high-level disinfection, critical items entering sterile tissue require total sterilization. This requires an industrial autoclave to destroy all microbial life. This grid displays the standard biomedical waste color coding system required for clinical environments. Anatomical waste and blood-soaked dressings go into yellow. Contaminated plastics like IV tubing go to red. Sharps must enter a white puncture-proof bin, while broken glass is assigned to blue. Sterilization and waste sorting act as the final firewall, preventing pathogens from re-entering the community reservoir. When these protocols are not followed, patients acquire new infections. The 4 major hospital-acquired infections are cowties, CLABSIs, surgical site infections, and ventilator-associated pneumonia. These failures, combined with poor antibiotic stewardship, drive the rise of antimicrobial resistance across the population. If an occupational failure occurs, such as a needle stick injury, the first response is to wash the site thoroughly with soap and water. This flowchart tracks the administrative workflow for post-exposure prophylaxis. Following the wash, a nurse must report the incident, secure source testing, and begin PEP within a strict time window. An infection or exposure indicates that a link in the protective chain was bypassed. Maintaining these protocols is the only way to ensure the cycle of transmission remains severed. Flawless protocol adherence is the clinical mechanism used to control patient outcomes and prevent the spread of disease. Differentiating between airborne and droplet precautions requires identifying the particle size described in the scenario. When a pathogen is smaller than 5 microns, the protocol dictates the use of a fitted respirator. In a doffing sequence question, the correct choice removes the most heavily contaminated items first, ensuring they are not dragged across exposed skin or mucous membranes. When sorting waste, check the material. A blood-soaked surgical dressing is heavily contaminated with bodily fluids, placing it strictly in the yellow anatomical bin. Evaluate examination scenarios for the intervention that is either the most immediate action to mitigate exposure or the one that maintains the highest degree of asepsis. These protocols are the foundation of clinical safety. Mastering them ensures that your practice actively prevents the spread of disease, protecting both the patient and the community.